Derek Jones, an anesthesiologist, and I'm 51 years old. Well, I found out, I never got a diagnosis from a physician. I take my blood pressure on a regular basis, and so I found out that I had issues with my blood pressure uh, probably 3 years ago. No, I wanted to avoid medication, so I tried some natural remedies, and initially what I tried was raw cocoa, and I
Okay.
would mix it into a smoothie and drink that, and it did help slightly for a short period of time, but it seemed to stop working at a point, and so I was looking for some other remedies, and was actually about to go see a physician to to possibly get on blood pressure medicine when I found out about the olive leaf extract. The systolic or top number was consistently above 140 and usually over 150, and the bottom number, the diastolic number, was usually over 90. 120 or less for the systolic, and 80 or less for diastolic.
Okay.
I would say about 165 over 100, low 100s. A little over a year ago, I'm assuming. It was a very good experience from the start. From the first day that I started taking it, I saw that my pressures normalized, meaning I started at three times a day, and within a week I was able to, I saw that my pressures were actually a little lower than I wanted them to be. So I went to 2 times a day, and that's where I've been since. So starting with those pressures around 150 over 90, really from the first dose. Remember the first day I was surprised, I thought that it might take some time for my pressures to normalize, but they went to 130s, and what was more significant for me is the lower number, the diastolic number, went in the 80s. When I was taking it 3 times a day, it was even in the 60s and 70s. I um, didn't necessarily want as drastic a change, and I knew that if it was in the 120s over 70s, I would be fine with that. Um, so that's where it usually stays right now, and this is all without any without much exercise. I mean, in the summertime I do swimming and that sort of thing, but definitely half the year I'm not really getting a lot of exercise in. I took a tablespoon 3 times a day with half a glass of water. First day, my pressures normalized. Again, they started at about 150 over 90. As the first day, I saw them in the 130s over 70s, and over the next couple days, 110s over 60s.
Okay.
And that at that point, I wanted to see what my minimum dose would be that would supply a satisfactory pressure for me, and I settled on twice a day. I take it in the morning and I take it in the evening before I go to bed.
So you've been taking it every day?
Every day, twice a day,
For how long now?
for about a year. The reason that I tried initially the cocoa, which I had what's called a refractory reaction where it didn't work as it did when it started, which is something that I was worried about with the olive leaf extract, but did not happen. Is that I know I'm in medicine, and I talk to patients all the time who take high blood pressure medication, and family members, and there are, with all of them, lots of side effects that range from fatigue, decreased libido, rash, cough, again, a refractory reaction where they don't work as well. And I wanted none of it. Some people take them and don't have any kind of reaction or side effect, but the nice thing about natural substances like olive leaf extract, they may or may not work, uh, but they don't have a side effect profile. It seems to be a generalized increase in energy. And of course, it doesn't mean that I'm always energetic. I still get very tired. But when I compare my time taking the olive leaf extract versus the time that I was taking it before, I would say that has been a benefit also. Absolutely. ACE inhibitors are a class of hypertensive medications. And as you said, that they can cause acute renal failure. Don't think we need to get too far into the details, but basically they interfere with the parts of the kidney or damage the parts of the kidney that filter, which is the kidney's main function. It works as a filter. So when these cells are damaged, the kidney's not able to do that, and the waste products that the kidney would usually deal with, it doesn't do as well, and these start to back up in the body. They stay in the body. And what ends up, what can certainly be the end result of this process is that you have to be on dialysis. And what a dialysis machine basically does is substitute for the kidney. So you have to have two separate an entrance and exit IV, as it were, one to take the blood out of your body, filter it in the dialysis machine, and after it has been cleansed, put back in, which is what your kidneys would normally do. But this class of hypertensive medicines, the ACE inhibitors, is well known that they often lead to kidney failure.
Okay, thanks for that explanation.
Sure.
And how long have you been practicing medicine?
Since 1992. So
Okay.
if I get
About 24 years?
About 24 years, that's right.
Before you heard about herbal results, have you ever heard about olive leaf extract for high blood pressure situations, or is that something that you just found out about within last year?
It was very new to me. I had not heard at all. I hadn't heard of olive leaf extract at all, let alone it treating blood pressure. So it was at a lecture that you gave, and I was immediately interested. It was around the time that I was considering taking hypertensive medicine, because again, the cocoa was not working in the way that it had when I started taking it.
Okay, and could you show people the bottle?
Here we go.
Okay, and that's the bottle you've been taking for about a year now?
That's right.
Okay, and would you recommend it for people in general?
Without question. And again, no one can ever say that something is definitely going to work for everyone. But the real reason to try something like the olive leaf extract is that in my discussions with people who have used it, it has been successful, and there really is no side effect profile. I mean, that's the real big deal, is that you are not going to have the kind of problems that we spoke about earlier with this product. Absolutely, he's not taking it for blood pressure, but
Okay.
But my uncle in New Orleans had one. He's 85 years old, and he has had some issues with appetite, memory loss, generalized dementia that would come gradually at that age, and he has a caretaker that helps take care of him, who is very familiar with natural remedies. And I suggested to the both of them, and he wasn't left out of this conversation, and to his son, that this should be added to his regimen and tried. So what was happening simultaneously, he was taking off some of his prescription medications and started using the olive leaf extract, and the results have been marked. He has gained weight. He was in the process of losing a lot of weight. His appetite wasn't what it should have been. But since taking the olive leaf extract, and this has been since February, so we're talking about 2-3 months now, real changes. One, his appetite is much better, and he's gained weight, which hasn't happened in years. But more impressive and more important than anything he's had a decrease in dementia. His conversation, how long he can have a conversation with you and what that conversation is about, has changed dramatically.
Excellent. Well, Dr. Jones, thank you so much for providing us your experience with Herbal Results olive leaf extract. And if there's anything else you would like to add, you can, take the last minute of this interview to add it. If not, we can end the interview now.
No, it's a pleasure to do it, and I would do this anytime, anywhere, because again, I think that this is the way that medicine has been practiced for eons, and I think in the last 100, 150 years, we've moved away from it, and I wouldn't say that we shouldn't deal with medicine the way that it's practiced now, and I practice medicine that way, so I don't speak against it. I see no reason to give up one for the other, is my point. So even though I'm a Western medicine practitioner, this is my preference and it's worked for me.
All right. Thank you so much, Dr. Jones.
Thank you.